Hello, welcome to the University of California, San Diego Chronic Kidney Disease Program. My name is Norma Regev, and I am a licensed clinical social worker. Our healthcare team includes a nephrologist, pharmacist, nurse, social worker, and a dietitian. My role is to help educate patients learn about kidney disease and the treatment options available to them. This is the first module of a 6-part series discussing kidney disease and treatment options. In this module, I will talk about treatment options for failing kidneys. Our goal is to help empower you with knowledge to make informed decisions about your kidney treatment choices. When you reach the point of choosing a treatment for kidney failure, it may seem overwhelming, or you may not be feeling well, or perhaps you're also feeling sad, worried, angry, or nervous, and hope this day would never come. Your healthcare team can offer support, education, and can be key in guiding you in your decision-making process. It gives some people hope to know that there are treatments today that can help you live long, well, and maintain a good quality of life. Choosing a treatment or not is a big decision, and understanding your options for treatment can help you feel more in control and empowered in your healthcare journey. There are some things to consider when exploring your options. Remember that it's always your choice. While it's important to talk with your family and friends about it, it's ultimately your decision, and you must do what's right for you. You should plan ahead by giving yourself some time to explore your options, since time is required to plan for the treatment you want. Talk to your loved ones because their opinions may matter to you. Talk with other patients to get an idea of what their experience is like. And remember, you can change your mind at any time. Think about your lifestyle and what is important to you and ask yourself, are there hobbies, travel, and other daily activities you wish to continue? In addition to medications and dietary recommendations, your doctor will help you choose what treatment option is best for you based on your current health and treatment goals. There are 3 main types of treatment for failing kidneys. Those include transplant, hemodialysis, done in-center and at home, and peritoneal dialysis, and finally, conservative management. In this module, I will give you an overview of all 3 of these options. A kidney transplant is when you receive a healthy kidney from another person. This can be done through a deceased donor or a living donor. Not everyone is a candidate for a kidney transplant, but your doctor will let you know if this is a good option. The transplant team will need to do a full evaluation to make sure a transplant is right for you. A successful transplant can help you return to good health. It's important to remember that a transplant is a treatment, not a cure. You will need to take medicine for the rest of your life and see the doctor regularly. Here is Gabriela Temores, a kidney transplant patient.
Well, my experience of receiving a kidney transplant was amazing. It gave me a second chance in life. I was able to get my health back and have my energy, also with the care of the doctors, and they reassured me through the whole process. I mean, it was amazing.
What have been some of the difficulties leading up to your transplant?
From being healthy and to then getting the news of stage 4 kidney disease. It was hard for me in the beginning to realize that I needed a transplant. Luckily, I had great doctors and a good support system that got through the process. I looked at my options, if it was through dialysis or if I would get that transplant. I think one of the difficulties that I didn't expect was the recovery process. I had spoken to other recipients or other people that you would instantly feel better. That wasn't the case for me. I needed my body to be able to recover, and I needed to be patient. Yes, it took about 6 weeks, and then I finally felt different. I felt that energy coming back. Also, I didn't expect to feel some remorse, a remorse that as a recipient, this is where that remorse that I had somebody else's kidney and now I had to be an advocate and take care of my health and take care of that kidney. Again, exercise, eat healthy. Yes, instantly there was things a limit on my diet before the transplant. So of course you want to indulge in those foods that you weren't able to consume. But I knew I had a responsibility to take care of the gift and the blessing I received, and and be my advocate if it's for my health, to be able to know that it's not an easy process leading up to it, but the reward you get from being a recipient and not having to be on dialysis and getting your health back is amazing.
How has your life changed since the transplant?
After transplant, I was able to go back full time. I took a couple months off to let my body recover, but I wanted to receive the transplant is what has helped me be able to work full time. I'm a mother of two. I stay busy. And again, it's because I received that transplant that I'm able to work full time as a teacher. And I'm back with my students. And again, I work as a teacher and I'm a mom at home and a wife.
When should I start dialysis? Good question. You and your kidney doctor will decide when to start based on your labs, kidney function, and if you have severe symptoms caused by your kidney disease, such as shortness of breath, fatigue, swelling, muscle cramps, nausea or vomiting, or having a metallic taste in your mouth. What is dialysis? Dialysis is a procedure used to treat kidney failure. It does some of the things a normal kidney does, like removing extra water from the body and removing the waste products that have built up in the blood. For hemodialysis, there are two types, in-center and at home. Hemodialysis uses an artificial kidney called a dialyzer and a machine. The dialysis technicians will place needles into your dialysis access located in your arm. Blood is then pumped through the dialyzer where extra water and waste products are removed. Plastic tubes carry blood out of the body, through the dialyzer, and back into the body after it has been cleaned. Hemodialysis is usually done 3 times a week for 3.5 to 5 hours each treatment. It is done at a dialysis center where nurses and technicians do your treatments for you. It can also be done at home where you and your care partner do your treatment together. There are a few considerations with in-center hemodialysis. You'll have the reassurance of staff-assisted treatment. You can ask questions face-to-face whenever you're there. All of your treatments, labs, and checkups will be done in one place. The schedule is more predictable. There is a lot of community choice for center locations, and you will need to arrange for your own transportation to and from the dialysis center. Here's what someone on in-center hemodialysis has to say about their treatment. Here is Gustavo Guzman, an in-center hemodialysis patient.
How often do you need treatments? Well, the treatments are 3 times a week for 4 hours treatment. And that's you just go in there and they clean your blood. Walk us through a dialysis treatment. Okay. When you get hooked up, the first thing you do is get weighted. You weight you, and then after that, the nurse starts calculating your weight on the machine, and then after they do that, the technician hooks you up. I mean, it means they insert the needles on your arm so they can start doing the treatment. And after that, we're saying that you be a week after dialysis. Yeah, it happened a little bit, but you find ways to cope with that. After receiving treatments, are you able to work? Yes. My normal life? Yes, I am. Before dialysis, I couldn't even walk. I couldn't walk from the door to you. I couldn't even walk. I had to stop because I couldn't breathe. My breath was now. I do triple what before. I was in that acted before. Like I'm now. I'm trying to do more than trying to take care of this body. What do you do when you go on vacations? I went to Las Vegas, and they have a lot of dialysis centers over there. So all you gotta do is just call them, and it's like you call them and you go over there. They have your information. You just go there and go in and out. That's it. And there's no hiccups. All you gotta do is just go to dialysis. There's no. You can still have fun. Don't go camping.
Here is what someone on home hemodialysis has to say about their treatment. Here's David Anjacos, a home hemodialysis patient.
So I chose home hemodialysis after initially being on home peritoneal dialysis. I eventually got so many infections with peritoneal dialysis that I could no longer use it because the area, the peritoneum, wasn't healthy enough to be used anymore. So I had to transition from that to a home hemodialysis. That was probably when I was 12 years old, and I've been on it since then. So it's like 14 years now that I've been on home hemodialysis. One of the reasons why I love being on home dialysis, regardless of option, is that it gives you a lot more freedom. You don't have to be on someone else's time. You don't have to, you can make your own decisions, a little more independent. When it comes specifically to hemodialysis, I enjoyed the fact that it would give me the option of having a more free diet. Right now, I do home hemodialysis 4 times a week for 4 hours, which is 16 hours a week. It's more than the 9 hours most patients get. And because of that and the meds I'm on, I have very little restrictions on my diet. That's one of the biggest reasons. The second reason is that I'd be able to continue going to school. I completed high school with a 3.5 GPA. I'm currently in a bachelor's degree in cell and molecular biology. About to finish that after 8 years of doing part-time school. Just recently I finished a stem cell research internship while going to school almost full-time and doing dialysis. So there's this huge amount of freeing up of my time that it has produced. It's given me the ability to continue to go to school, to continue to get my education. And then as I got better at managing my time, doing dialysis at night, and working during the day, I've been able to do more things. And it's just every step is a new step to independence. And that's the biggest thing for me. You're, not only will you be feeling better because you can ask your doctor to do more dialysis time, not only will you be able to eat more if you have that more dialysis time, but you'll feel better, you'll have more energy to go exercise or go, if you're elderly, hang out with the grandchildren, travel. If you're younger, you'll have more energy to go to school and get a job and do all of these things. It's it's amazing. And I've seen a lot of the data that says only 2% of dialysis patients are on home hemodialysis. And I think about 10% are on home peritoneal dialysis. I think it's a travesty that only 12% of dialysis patients have this level of quality of life. And it doesn't stop there. Home hemodialysis is the best way right now that we have.
Hemodialysis at home is very similar to in-center hemodialysis, only it's done in the comfort of your own home with slightly different equipment. There are some pros and cons related to hemodialysis. The pros are, you can schedule your treatment around your life. You will have the ability to have fewer food and drink restrictions, take fewer medications, keep your social, school, or work life more flexible, and you and your care partner are the ones doing your treatment so you can have more control. The cons include, it will take approximately 6 to 8 weeks of in-center teaching before you can start doing your dialysis at home. You will need space to store supplies. You will not be able to see and talk to the doctors and nurses as often. And finally, your care partner is the one responsible for inserting the needles into your dialysis access in order to perform your dialysis treatment. Let's move along to access. There are different ways that access to dialysis happens. A vascular access is the way blood goes out of your body to be cleaned. There are 3 main types: a fistula, a graft, and a catheter. Let's talk about each one of these in more detail. A fistula is where an artery and a vein are surgically connected to each other. Fistulas are usually placed into the arm. There are some pros and cons. The pros are that it's the best choice for access. There is less chance for infection or blood clots. It may last many years, and there is increased blood flow in fistulas. Some cons are that it may be visible in the arm from outside the skin. It could take several months to develop and mature. It may fail to mature and you might need another surgery. And not everyone is a good candidate for this kind of access. An AV graft is the next kind of access that involves joining an artery and a nearby vein with a small, soft tube made of synthetic material. It sits underneath the skin. Let's talk about some pros and cons of this type of access. Some pros include, it can be readily implanted, it has predictable performance, and can be used sooner than an AV fistula. Some cons are, there is an increased potential for clotting and infection, and it may not last long as a fistula. Finally, a catheter is the last type of access. A catheter is a temporary tube inserted into a large vein in your neck or chest. The ends of the tube sit on your skin outside your body. This type of access is generally used immediately when you need dialysis urgently or for a short period of time. Some pros are that it can be used in an emergency situation, it can be placed quickly and also used immediately. Some cons are, it has the highest infection rates, may require longer treatment time, it can have inadequate blood flow, it has the highest rate of clotting, and tends to have increased hospitalizations. Let's move on to peritoneal dialysis. It uses a part of the body as a blood cleaning filter instead of a machine. The peritoneum is where dialysis occurs. A thin lining called the peritoneal membrane covers the space and acts as a dialyzer for your blood. It's used to remove excess fluid, correct electrolyte problems, and remove toxins from the body. Peritoneal dialysis access is done with a catheter. A catheter is placed into your abdomen through a surgical procedure. A small portion of the catheter will be outside of your body, but your clothing covers it when you're not using it. It can be done manually or with a cycler. With manual peritoneal dialysis, the patient performs the exchange without a machine. A special fluid called dialysate is put into the peritoneum and stays there for several hours. Waste products and extra water move through the peritoneal membrane into the dialysate. Then the used dialysate is drained away and replaced with fresh dialysate. This is called the exchange. Manual exchanges are done for the first 30 days while you're learning. Manual exchanges will also have to be done if the electricity goes out. They require a clean place and take about 30 minutes per exchange. After the first 30 days, exchanges can be done at night while you're sleeping, using a cycler for 8 to 10 hours. Depending on your prescription, you may have to do a manual exchange during the day as well. There are a few things to consider about peritoneal dialysis. The nurse in your clinic will teach you how to do your treatments, and it can take around 1 to 2 weeks. You usually have 2 clinic appointments per month. The treatment is gentle, so it causes less discomfort. Your exchange area must be kept clean. You must wear a mask when doing exchanges. Your catheter and skin should be cleaned daily. You will need storage space for supplies that will be ordered for you by your clinic. Treatment is done daily, but can be flexible as to when you do it. And you can plan it around other activities. Here's what someone on peritoneal dialysis has to say about their treatment. Here is Marilyn Hardy, a peritoneal dialysis patient.
Well, my experience with peritoneal dialysis, I actually was about to go on a trip to go see my granddaughter, who's 8 years old at that time, and I was at getting ready to get on the airplane, and my kidney failed. So they gave me a choice for the peritoneal dialysis or the other dialysis, the hemodialysis, because I wanted to still travel, so I got the peritoneal dialysis so that I'd be able to still be able to travel. And also that the idea of doing it at home was more appealing to me than going back to the basement in the hospital.
What have been some of the difficulties with peritoneal dialysis?
It's not really been very difficult. It hasn't been very difficult because I have a great team of doctors that work with me at the clinic. And the hardest part is bringing those bags in every day and every night and making sure that my site stays clean so that I don't get infections. I'm still able to get out and garden, and me and my mom go different places. And I have traveled with my suitcase. They have a special suitcase for it, my machine. So yeah, I live a kind of normal life with the peritoneal dialysis.
Why did you choose peritoneal dialysis?
Being able to still see my grandchildren, travel with them, or being able to watch them, babysit them, those are just, my grandkids are everything. And the idea of being able to dialyze at night at home, other than sitting in the basement at the hospital for 3 hours, and then when you come off the machines at the basement, you're completely wiped out. You can't do anything for the rest of the day. Your days are just done. It's not painful at all because I don't cramp up like I used to when I would do the other dialysis. I can sleep through it because the cord is long enough where you can roll over, and I can sleep for the 9 hours that I have to dialyze. Sometimes I'll wake up in the middle of the night because the machine's going off, but most of the time you can sleep through it.
Would you recommend peritoneal dialysis to other patients?
I think I benefited from PD because I'm able to hook myself up. I don't have to go through all the pain. I'm able to garden. I'm able to go walking with my mom. I'm able to play with my grandkids. I'm able to go on trips with my friends, small trips, because the larger ones I'd have to mail my boxes. PD it's just been a much more freeing experience than the hemodialysis is.
The final thing we will discuss is conservative management. Conservative management for kidney failure means that your healthcare team continues your care without dialysis or a kidney transplant. The focus of care is on your quality of life and symptom control. This is usually decided on when other options will not improve your quality of life. Treatment options for conservative management can include avoiding treatments and hospital stays that may impact your quality of life. This may mean fewer medical appointments, blood draws, and medicines. Managing other health problems caused by kidney failure, like anemia. Providing you with additional emotional support. Helping preserve your kidney function for as long as possible. Management of your symptoms such as nausea and poor appetite. Optimizing your quality of life, and preparing for end-of-life care. Here's what a nephrologist has to say about conservative management. Here is Dr. Tamara Rabenzig, nephrologist and palliative care specialist with UC San Diego Health.
Really, anybody can consider conservative kidney management. Most often, however, conservative kidney management is considered in patients who are less likely to derive a benefit from dialysis. Patients who fall into that category include patients who are older with multiple medical problems, and those patients might not live longer with dialysis and might suffer greatly from a much more negative quality of life on dialysis than they would without dialysis. Really, it's about whether or not you would benefit from conservative kidney management and whether or not it's something that you want. I would say the biggest consideration for someone who's thinking about conservative kidney management is thinking about the quality of life associated with dialysis compared to conservative kidney management. We do know that most people who choose dialysis, either hemodialysis or peritoneal dialysis, will live longer with dialysis than they will with conservative kidney management. That benefit of living longer goes down greatly in older patients and patients who have a lot of medical problems. That can be a little harder to predict, however. So really, when thinking about conservative kidney management, I really focus in on the quality of life and encourage patients to think about what quality of life they're looking for as they look ahead. So conservative kidney management avoids unnecessary procedures, extra procedures and surgeries, more time spent in facilities or in the hospital away from their family. Conservative kidney management avoids those things. So if you go down the path of conservative kidney management, you don't have to worry about a surgery for access placement. You don't have to worry about going to the clinic 3 days a week for dialysis. You avoid the complications associated with dialysis that often lead to frequent hospitalizations and more time away from family. And even in individuals who might consider peritoneal dialysis, that also requires a surgery and requires nightly peritoneal dialysis at home. 3 days weekly hemodialysis can lead to a lot of symptoms. It can lead to a lot of fatigue after dialysis. A lot of patients, especially, again, older patients, more frail patients who go to dialysis are pretty wiped out the whole day after dialysis. So they essentially lose those days, the dialysis days. They're spending them either at the dialysis unit or recovering from dialysis. So just, thinking about the main patients who would benefit from conservative kidney management. Again, patients who are older, who have multiple other medical problems aside from their kidney disease, they're the patients who would derive the most benefit from that treatment path. Patients who really feel as though the cons of dialysis are greater than the benefits. Patients who feel as though going to hemodialysis regularly, doing peritoneal dialysis nightly at home is a large burden, would negatively impact their quality of life. When it's a life that they can't imagine living, those are the patients really who should really consider conservative kidney management. There's another group of patients that I haven't touched upon, and those are patients who might not be able to safely receive dialysis, patients with cognitive dysfunction, and patients who might have, severe other underlying medical problems such as severe heart failure or severe liver disease, where dialysis itself really might cause more harm than good. Those patients as well would really benefit from conservative kidney management.
What does conservative kidney management involve?
It's not doing nothing. It's really aggressively managing kidney disease and the side effects of kidney disease, doing aggressive medical care up to actual dialysis. So what it usually involves is frequent visits with your nephrologist and your nephrology team. Often in advanced kidney disease, that can be as frequently as once a month. It will involve taking a look at labs, taking a look at physical exam and symptoms, and adjusting medications to target any symptoms you might be having, and also to help your kidneys work for as long as possible. So it's still complete aggressive medical care, just leading up to dialysis. As kidney disease progresses, as symptoms progress, you might need to see your doctors more. Sometimes other teams might be brought in, such as palliative care, teams that really focus on symptom management beyond what the general kidney team can provide. And then as kidney disease progresses more, if patients become have a harder time going to the doctor, start to have more symptoms and feel more unwell, when patients get closer to the end of life, at that point, your providers might start talking to you about hospice care. And hospice care really focuses on end-of-life care, on keeping you as comfortable as possible. At that point, your doctors wouldn't be checking labs frequently, but would really be focusing on symptoms and on keeping you home and comfortable with your family at the end of your life. I would add, just for patients who are considering conservative kidney management, to just really think about the pros and the cons of dialysis and of conservative kidney management. Some of this I've said already, but really thinking about what your goals are in life, what your goals of care are for your medical care, and what you're hoping for as time goes on. The other important thing to remember is that you can always change your mind. So choosing conservative kidney management isn't a decision that's set in stone. You can make a change. So for some patients, they might choose conservative kidney management. They might decide that they don't want dialysis and go down the path of conservative kidney management. But if your goals change or symptoms become severe to the point that you would like to try dialysis or switch to dialysis, that is an option. In the same regard, some people might choose dialysis, and they might start on hemodialysis or peritoneal dialysis, and at some point might decide that's no longer for them. They don't want to continue renal replacement therapy, and those patients might choose to switch to conservative kidney management. So you can always change your mind.
Congratulations! You've completed the module on treatment options for failing kidneys. Please check out our website for additional educational modules in this series on kidney failure and treatment options for failing kidneys.